We are continuing with the rest of the PSC questions. Next question is question number 60, question number 19. Huge tumor-like overgrowth of scar tissues is called A. chancroid, B. cellulitis, C. eczema, D. keloids. The right answer is keloid. Chancroid is a bacterial sexually transmitted infection characterized by painful sores on the genitalia. And eczema, it is atopic dermatitis characterized by dry scaly skin, and cellulitis, bacterial infection of the skin. So the right answer is keloid. Next question. Pus in the pleural cavity is A. pleural effusion, B. emphysema, C. emphysema, B. empyema, C. pyorrhea. So pus in the pleural cavity is called empyema. Pleural effusion is, it is the accumulation of fluid in the pleural cavity. And emphysema is a condition which is a pathological condition that affects is characterized by enlargement of the lung spaces with the destruction of the wall of the alveoli. And pyorrhea is otherwise called periodontitis. It is the inflammation of the gums. So coming to the next question. For administering 3000 ml of fluid over 24 hours, the flow rate is A. 31 drops per minute, B. 15 drops per minute, 40 drops per minute, 52 drops per minute. So what is the right answer? The right answer is 31 drops per minute. How will you calculate? 3000 divided by 24 hour into 60 into drop factor. Here the drop factor, if you take it as 15, you will get 31 drops per minute. So 3000 into 15 drop factor divided by duration in minutes, that is 24 into 60. Then you will get to 31 drops per minute. Okay, next question is birth injury due to damage of the sternocleidomastoid muscle is Chignon, facial palsy, torticollis, and Klumpsky's palsy. So what is the right answer? Right answer is torticollis. Damage of neck muscles cause head be twisted or tilted to one side in torticollis. Klumpsky's palsy is a neuropathy of the lower brachial pulses which may result in difficult delivery of the baby. It is the injury of the brachial pulses. Chignon is hair arranged at the back of the head of a woman. It's called chignon. So that's about that question. Next question is, which of the following is a complication of blood transfusion? A. citrate toxicity, B. calcium overload, C. magnesium toxicity, and D is hypotension. So the right answer is citrate toxicity. When citrate in the transfused blood is begin to bind to the calcium in the patient's body, you will get hypocalcemia, and there is chance of hypomagnesemia rather than increased magnesium. So there is no chance of magnesium toxicity or calcium overload. There are chances of hypocalcemia and hypomagnesemia, and there can be hypertension, not hypotension. Okay, so citrate toxicity is a complication of blood transfusion. The next question is vitamin A prophylaxis program. In vitamin A prophylaxis program, the dose of vitamin is 1 lakh for 6 months to 11 months, and from 12 months to 5 years of age it is 2 lakh international unit. Since the age is not specified, it can be both answers. Central separation of placenta is called controlled co-retraction, B. Schulz method, D. Duncan-Matthew method, expectant management. Central separation of placenta is Schulz method. Matthew-Duncan method is where the placenta slides through the sides of the uterus. Pre-induction assessment score is Bishop score, Apgar score, Latch score, and Kreis. Pre-induction score is Bishop score. Bishop score, if it is more than 8, it is said to be favorable. The 5 components of Bishop score, they are cervical efficiency, cervical dilatation, cervical consistency, cervical fetal station, and cervical position. So these are the 5 components of Bishop score. If it is more than 8, it is considered to be favorable.